Our patient, who's 30 years old, is about 3 months out from her symmetry operation for her breasts, and she's very graciously come in today in follow-up, and she's agreed to share some of her thoughts and feelings about the frustrations she had before surgery and how she feels now.
Hi. I can say I was thinking about surgery for a really long time, but I was always pushing it off, felt really nervous that whatever surgery I would get wouldn't feel natural to me. But I can say after getting surgery, I'm so happy that I did it, and it does feel like a natural part of my body. So it's been great.
So let's dive into some of the specifics of your unique situation. You were born with really two different sized breasts, and as you matured, they continued to be even more asymmetric.
Yeah.
So what were some of the things that you did to try and adjust for that as you were growing up and as you were an adult?
I'd say I always had really small breasts, so I didn't really even notice anything until I became pregnant with my first kid. And then I just had one breast that really became enlarged and where I was able to nurse from, and my other breast hadn't changed at all. So that's really when the asymmetry started feeling uncomfortable. I started feeling like I needed to be wearing bras all the time. There was like a very clear asymmetry that just for myself I didn't love, because it felt really different than what I had felt like and looked like before having kids. I was mostly just like wearing tight bras all the time to try to like even them out, or mostly hide them away.
Yeah.
So now it's really nice that I don't feel like I need to do that.
Yeah. And so our solution that we came up with was to put implants in both sides, but different size implants, and then to do a lift on the breast that was a little, we use the word ptotic, but you might use the word droopy.
Yeah.
And now that we've finished that and you're a couple of months into this, do you feel pretty symmetric?
Yeah, I feel like definitely pretty symmetric, way more than it was before. Yeah.
Fabulous. Do you remember what cup size you were before?
I rarely wore bras with cup sizes, but I guess I'd be like an A, if not smaller.
And have you been out looking for bras lately?
Not besides sports bras, but that's what I like. The goal of the surgery was to be able to wear no bras, but my guess is probably a B.
Okay.
Yeah.
Very natural and very athletic. Okay. And absolutely, you can totally go without a bra.
Yeah.
And it's not going to negatively impact you whatsoever. What were some of your apprehensions that you had leading into surgery?
I think I was just really nervous that they would look like very obviously fake, or like, I never wanted like very large breasts or something that would really stand out. I just wanted something that felt natural to me. That's exactly how it feels. Like I was worried that they'd be like up to my chin with lots of cleavage, and that I wouldn't be able, like my t-shirts would feel weird, but that's not at all the case.
Perfect. Do you feel more comfortable?
Yeah.
Fantastic.
Yeah.
Many patients would ask, is this something that you would recommend to a friend?
I think so. I mean, every person has their own journey, but for me, this was wonderful, and I was lucky to have a lot of support going into it and feeling really good.
Awesome. Well, thank you so much for sharing your journey.
Of course. Thanks. I feel like I was on